So we're ready whenever, and I will, if I may, for the benefit of the secretary, may I turn this on? We have another recorder that I believe Laura Condon has placed on the table here, and for the benefit of the secretary, we are recording on the Kids Back recorder, which will be used until the minutes are approved, and that is not the record of the organization, just the final minutes. So I'll put that down here as a recorder as well. Thank you.
Yeah. Excuse me, in further disclosure, yes, I do have the audio recording. I have video recording as well.
Okay, so we're both audio and video recording by Laura.
Okay. Welcome, everyone. Thank you for coming today. I apologize for starting a little late. I will try very hard to keep us on task and still hopefully complete the meeting by 10:30. At this point, everyone should have had an opportunity to look at the agenda. Do board members have any other matters that they would like to have added to this agenda today? Okay, hearing none. Do we have any individuals on the conference call today?
We have not opened the line because we're aware of no director wanting to participate by telephone.
Okay, great. In your board packet, you should have a copy of the draft meeting minutes from our January 21st meeting. Is there any discussion on those meeting minutes?
I do have one item. I see that you put together a legislative task force, and I would like to participate on that as well.
Fred, can you make that note?
Yes, thank you.
Is there any other discussion regarding the minutes from the January 21st meeting? Hearing none, would somebody like to make a motion that we approve these meeting minutes as they are published? Would somebody like to second that motion?
I second.
All in favor, aye. Aye. All opposed? I hear that is unanimous.
Actually, I'm going to abstain because I wasn't.
Okay. Okay, we are on to a report on our consultation with our legal counsel.
And as we discussed, I had raised a few meetings ago the fact that the new statute, the amended RSA 126Q, broadens the assessment base considerably. It no longer piggybacks on the New Hampshire Health Plan assessment base. And in looking at that literally, it also arguably would encompass the MCOs, which manage the state's Medicaid enrollees. And I was asked to look into that to determine whether it required a legislative amendment or could be handled by the plan of operation and the legal issues involved. With respect to a legislative amendment, there are a number of hurdles. One is a timing issue. The insurance department is not submitting or did not submit a technical bill this session, and it would probably be at this late date prudent to try to introduce this topic as a technical amendment at this point. So my focus was on whether this was appropriate for a plan of operation amendment. In looking at the revised statute, it clearly reflects an intent to broaden the assessment base, but the statute also reflects a structure that this association in the assessment base is intended to cover only the non-federal portion of the vaccine program. So clearly under the VFC program, you can have a state, which our state does, use the federal discount to purchase vaccinations, but those vaccines can't be used for those children that are directly federally eligible, and that includes children enrolled in Medicaid or the CHIP program or uninsured. And so the notion, and there's also a notion in the statute that you don't want double counting, and there's the ability of the association to work with other states if children living in New Hampshire are somehow vaccinated in another state. There is an intent that there not be a duplication of costs. So if you look at an assessment against the MCOs, clearly if the MCOs have no enrollees that are benefiting from the state purchased funds, they are paid directly on the federal side. And in fact, the state purchase funds can't be used for the Medicaid enrollees that are managed by the MCOs. And furthermore, they have no base on which to pass on this cost. And so that also leads to the additional practical legal problem that these MCOs have contracted with the state under a New Hampshire Insurance Department bulletin that clearly stated that they were not subject to vaccine assessment. Now that bulletin was based on prior law before this law was amended and no longer piggybacked on the New Hampshire Health Plan. But clearly that was the basis for which the contract was made, and so therefore there's no contractual provision either for the MCO to pass this cost on anywhere. It's an unexpected considerable cost, and therefore it would likely result in considerable resistance, if not legal action, by the MCOs if our organization were to, at this point, try to pass on an assessment for a population that the benefited population from this vaccine program is not managed by the MCOs. So they and their population they manage don't receive the benefit at all from the cost of this program. The other issue would be if as this contract expires and the assessment were again enforced against the MCOs have no enrollees in which to pass this cost on to, so it would be pushed back as a state cost. I haven't looked at the period Medicaid regulations, but I think it raises the issue of whether the state paying an MCO to cover the state portion of an assessment for vaccines is an eligible Medicaid cost. It really is kind of whipsawing back and doubling up the cost to the state of vaccines that otherwise should be paid directly once by the feds, and I don't think the feds would reimburse the state for paying that same cost twice for an MCO assessment. So for those reasons, I think that this issue almost certainly was not contemplated by the legislature. It's something that has arisen. The statute gives the insurance commissioner the right to approve the plan of operation. It gives the Health and Human Services commissioner the right to identify assessment problems and ask the association to fix them. So I think if the association is careful in identifying the issue and making clear that it's not necessarily the assessable entity, but the assessable lives that are covered by the federal program, which should not be subject to the second additional assessment by the state program, then I think it's a matter that could be handled in the plan of operation, because again, we're having it reviewed by two governmental agencies. It may be prudent, however, to wait until the final insurance coverage, formerly known as Medicaid enhancement or extension, until that's finally determined by the legislature, so you have a clear understanding of the population that this may affect.
Does anyone have any questions, comments? Mark, do you think that there would be a risk for us waiting until the end of the legislative season to see what happens with Medicaid expansion?
I don't see that there's a practical risk, because really the parties out there that would be most impaired by any decision would be a decision to follow the literal language and expand the assessment to the MCOs. And so currently we're not assessing the MCOs, so I don't see that there's essentially any additional risk.
I think hearing no comments and no questions, I think we're on to our executive director report. Fred?
In the packet is a two-page report that basically reports on the process of implementing the new assessment system. That has gone well, not easily of course, but gone well. So we have had 2 training sessions. We've had a number of helpful comments, a boatload of questions, which you would expect because we have written to 1,000, how many additional contacts? 1,300 additional entities were contacted to be, so we could make them aware of the potentially broadened sweep as we sought to deploy the assessment more equitably. We knew there weren't 1,300 more entities that would be subject to the assessment, but we didn't know how to tell on our own because there were no records that would identify which of these entities has accessible lives. So we've written to them, alerted them to the law, and then we have been fielding and responding to their questions. Several of you have been helpful in helping us work through this multi-tier stop-loss coverage topic. You may recall that now technically both the stop-loss carriers were accessible entities. Now the ASO firms and TPAs also are accessible entities, and the statute as adopted wisely cautions us not to double count or to take steps to avoid double counting and gave a default rule. That is, if everything else is equal and there's no agreement between the parties to the contrary, the entity that's paying the medical claim for the administration of the vaccine will be the entity that reports and pays for the accessible lives. We've urged people to make sure that's clear in their private agreements, and we've also advised them for the board's general guidance last meeting that if in a tier of coverage the parties want to change that allocation, enter an agreement and tell us about it. We don't have to approve the agreement, we have no role in that, but we will accept their different allocation. And we have one union plan that did just that. They had made an arrangement with a stop-loss carrier, but the stop-loss carrier would pay all state assessments for any purpose at any time. And as a consequence, that stop-loss carrier for that particular union plan, which has a small TPA shop involved in handling the negotiations, will be paying and reporting the accessible lines. But by and large, I think the default rule is what entities are following. We have some FAQs for consideration that are advisory at this point that are trying to document our responses on the servicing side, and we welcome further input in that. But overall, it has gone very well. We have made some further adjustments to the assessment system based upon people's experience, and the training materials have been posted to the website, so somebody who missed the training can certainly do that. But literally, once the record is set up for an entity, which itself takes about 15 to 20 minutes, the quarterly filing consists of filing 3 numbers, the number of covered lives in each of the 3 months of the quarter. It is literally about a 5-minute job. And the reports from the industry is they're very pleased with the way the design is. Intentionally been kept extremely simple so that once the name and contact information is there so we can communicate with folks, then the actual quarterly filing is a straightforward process. This is the same process with some improvements in the underlying technology that was deployed successfully in Maine, and it imitates the Maine system so that the carriers that are multi-state and have their reports already written, their report extracts for compliance with the state of Maine, can use the same thing in the state of New Hampshire. Someone asked last week, should we do multi-state activities, or last meeting? Vermont is deploying a similar system. Vermont is different in that adult vaccines are included as well. So it's a little different, but a similar kind of reporting. So indeed, I think the servicing people generally, the carrier servicing people seem to be pleased with the tool, that it's relatively friendly and easy to use. We also have established a state-specific helpline, help@nhvaccine.org, in which an assessment help issue, which is in May, we're collecting 1 year's worth of assessments, that there's a ready way to put that to the top of the list and get our immediate attention. We also are doing cross-state comparisons because Maine, which is a public body and its records are public, but for the specific carrier numbers, but we now have a pretty good idea about the national carriers who have regional footprints, and there are a number, one of which, of course, we know well, United Healthcare, that had the realization that it had been underreporting and self-corrected that. So there are other multi-state carriers that have some national accounts that have some membership footprint in New Hampshire, and those were among the 1,300 entities that we contacted just to alert them to this change. So I think overall it's going well. We have been just swamped with work on this, but I think it's getting a little better. I'm looking at Lori Beth, who's fielding a good deal of these calls. She's not. You're very, very kind, Lori Beth. I'm not saying no, it's getting worse, but I think we're getting better at it. And the system issues are all, there never were system issues, but we have heard and made changes that are responsive to how it can be more intuitive and work better. So I think the short result is we're ready to go in May. We are expecting to collect about the numbers that were in the survey in terms of accessible lives, which means we think our math is going to work pretty well. If anything, because of a 1,300 carrier sweep, we would expect the accessible lives to go up. And they should go up by some number, we just don't know how much. I think as everybody sort of anticipates, knowing the New Hampshire market, the big ones are at the table, the biggest ones are at the table, and because of the legacy way this board was structured, and the others we know about and are reporting regularly. So we're not expecting the numbers to move dramatically, but we are expecting them to go up. And I think more importantly, as business moves, which it is in this volatile market, hopefully wherever it goes, it'll find a carrier that's familiar and reporting in the system. So I think we'll be pretty stable here on the self-reporting side. I do apologize to you. It is entirely my error about the delivery date on these documents. There's a substantial amount of materials to review, and I realize the board needs some more time on that. Hopefully we've got them in shape where they will be readily reviewable by everybody, but we'll be talking about that a little bit. So that's it, unless there's any questions on anything there.
I do have one question regarding the union that is going to pay their assessment through their stop-loss carrier. Do we have a vehicle for monitoring that? I just want to make sure that in the event that that particular union were to drop their stop-loss coverage, that we do have a mechanism for that to go back into the TPA, that we don't end up
That's a
losing
really
those lives.
further point, which is a good point. And we should make a note of that.
Okay.
We do have a vehicle by which it is reported to us, but Claire, Sue's making a different point. Those who report no, we probably, well, not we probably, Sue is suggesting, I think it's a good idea, we should track those. There's going to be a handful. It's going to be a handful of people reporting no to the fact that the interrogatory is, have you reported all your covered lives? And so the TPA in that case is reporting no, they are not. And the reason they are not is because the stop-loss carrier has, by contractual agreement, agreed to report and pay for these covered lives.
Right.
So all those no answers we need to separately call out and track them to see that it makes sense.
Yeah, I just want to make sure that in the event that these people drop their stop-loss coverage, that they roll back into the TPA, so that they're captured somewhere and they just don't fall off the face of the earth.
Right. I see that as an obligation of the TPA.
It is,
As
yeah.
opposed to a tracking it. I mean, maybe we want to track it for our own purposes, but, you know, and my comment, I did have a comment to your comment that this is relatively a smooth rollout. It certainly has not been a smooth rollout for carrier, at least for Anthem. This has created a lot of issues with our large accounts, our large self-insured accounts who have stop loss because their stop loss carriers were assessing them. And we came into the mix and said, we're going to start assessing you. And then they said, wait a minute, we've already been assessed for this. So we've had to have a lot of conversations with all of our self-insured that have stop loss over the last 2 months, some not great conversations. So I just want to be clear that it has been a ton of work on the carrier's part to figure this out with our large self-insured groups, because they were very concerned with the fact that they might be double assessed for this. How are we going to know at what point the stop loss carrier stops and the insurance carrier, the TPA, starts? And I think to your point, Sue, one of the things, and we worked this out with FAQs, and the fact that now there has to be this agreement in place if the stop loss carrier wants to continue to assess and the TPA doesn't. And the thing is what we said from Anthem was, then we want indemnification language because we are responsible for this. And so you can imagine when you start wanting to do a contract, put indemnification language in, you're getting into these negotiations with these stop-loss carriers for the vaccine assessment. So it has not been easy, and we're trying to come to some simplified agreements, but because the law says, we as a TPA are on the hook in the first instance, we really felt like we had to do a lot of work to ensure that where we're not doing it, where our ASO has said, we can't let you do this at least until a certain point in time, we felt we needed some protection from that so that we weren't on the hook in the event you came back in a year and said, this was yours and you didn't report on this.
Marie, I apologize, I didn't mean to diminish, I know you have done, and Anthem in particular has been all over this in a very positive way. I didn't mean to diminish how hard it was for the carriers. I apologize. I didn't
No,
mean to
it's
suggest
fine,
that.
I just want to be clear that this
there's been
idea
some
of an
transitional
agreement
pain, yeah.
is more complicated than it sounds because of this indemnification, and people don't really want to give indemnification to each other, so.
Yeah. Fair enough.
Are there any other questions or comments on the executive report?
I just asked, has there been any word from TRICARE on their activities or any follow-up to that?
Yes.
Oh dear.
But not with respect to the assessable lives states. Washington, I think, the same report I gave last, basically, except ironically, TRICARE is paying by mistake some claims in Washington where the providers are billing by mistake. It's just hilarious. It's hilarious, sad. TRICARE is saying they will pay the assessments in the state of Washington, which is our breakthrough result. Now that's easier because it's on a per dose level, so the equity concern isn't there. They have raised the concern that they will not participate in a plan where they're paying twice. That is, if a child is immunized on a military base, they're also paying an assessment. And so we've offered some language in the plan of operation that will enable us to remove that. I think that is an absolute bar to their participation. But they also have said, we'll get around to these other states as well, but it's hard. That's where they are right now. Now that sadly is a change, because in last summer, we were assured by the General Counsel of TRICARE that this will be resolved by the end of calendar year 2013. And at the end of calendar year 2013, almost nothing had happened except these erroneous payments started to come. And we've inquired, and they said it's really hard. The congressional delegation from the state of Washington is chiming in. The congressional delegation from Maine already has. To communicate to TRICARE, their expectation is that they will participate in the state's plan. So what's new is they're not saying no, we won't. They're saying yes, we will. But what's newer is they're saying, and it's really hard. So that's where we are. We are continuing to watch this. We have not done anything, spent any money for New Hampshire yet, nor have we suggested that the congressional delegation might want to file a bill for some of the reasons we talked about here on other matters. Nobody knows what that bill needs to look at right now because of so many changes going on. And if they will voluntarily resolve it administratively, we're ahead of the curve on this. So there is a task force that's tasked with doing that, but the task force is working on it when they can, which feels like never, but that's where we are.
Are there any other questions, comments, concerns? Hearing none, I think we're ready to move on to the February financial statements.
Okay, the financial statements are pretty much unremarkable this month. All activity will take place in May when we start receiving our assessments. If you look at your statement of financial position, our cash is at $15,000 and our short-term investment is at $5,153,000. That will be used as part of our assessments in May and part of the payment back to the state. Our prepaid is the $6,415. That's our D&O insurance that we need in January. Total assets is $5,174,000. Our current liabilities is the liquidity liabilities and net assets is 531.74. If you were to look at your statement of activities and change in net asset, very little activity. There is professional fees, that is marking Hughes, administrative services is CML, and the insurance is our amortization of our insurance for D&O for 6241. So we have unrestricted net assets for the end of the year right now at 10,741 for this month. And for the year, 151,073, which was carried forward onto your statement of financial position. Are there any questions?
Hearing none, I think we're on to the update on the training days for Lori Beth.
And I don't have much to add to that, beyond what Fred already told you about the trainings we did for the new assessment system. The only thing I will add is that, we've incorporated questions we received during the sessions into our FAQs. I'll review those later in the meeting. But we think that it would probably be helpful to hold another training session a little bit closer to the due date. We did one in January, one in February. We think those were helpful to the payers. And we think that if we do another one in a month or two, we should get all the stragglers at the end there. So,
I actually listened in on the first one and following along. I thought it was very well done. You guys did a really nice job. It was very straightforward, very easy to follow.
Thank you.
We are now on to the update from the Department of Health and Human Services on the immunization system.
The immunization contract continues to move. What day do we have it scheduled, Marcela?
I think we moved it into April, I think April 9th.
April 9th should go through council. And hopefully we will be able to quickly move after that. We have all of the business plan, all of the needs and all of the things ready for the approval of the contract.
Does anybody have questions, comments? Hearing none, I think we're now on to the 2014 annual report.
and that, again, I don't have very much to report on. We published the report to our website. It's been up for several weeks, and we made all of the changes that were discussed at the last meeting. We sent it around for final review. And we understand that from the last meeting that we're to distribute it to medical facilities around the state, legislators, and professional associations, such as the pharmacy associations and things like that. So we're compiling those lists, and we anticipate that the annual report should be distributed to all those people by the end of this week.
And how many do we think we're going to be distributing?
We're not entirely sure. That was part of the work that we're doing, where we're collecting all those lists, because we don't have access to addresses for all the medical facilities and places like that. So we're not entirely sure what that's going to look like, but we're going to attempt to do as much of that as we can through electronic means.
Okay.
So, is the plan to have all of those hard copies?
No, I think we were hoping to do mostly electronic
Okay.
transmission,
Yeah,
which is
that
where
was
the
my-
addresses come into play.
Okay, absolutely.
And that, I think that was the instruction of the board, and that was part of our agreement to do all that.
I think that's why we changed the format. Remember, we
Right.
originally had the trifold,
Mhm.
and then we went to the full-page format because we said we wanted to distribute mostly electronically as opposed to paper. It's our initiative to be green, save expense, postage, and
Just
such.
double checking.
Yeah.
The other piece on that is the document itself hot links to the resource documents, so that the full audited report, if somebody sits our annual report, they've got a summary financial data, they can click on it, they get the full audited report. There are several hot links like that, but by your comments, there's a hot link to the immunization program.
Okay.
And to our website. So the thought is, this now supports this two-page summary fashion, and anybody who wants to drill down, everything that's referred to there, we believe it's numerical. The reference links are there, and the hot links bring up the actual sources.
Are there any further questions or comments? I think we've sort of already touched on this, but do we have anything else to discuss on the update, on the status to consider possible technical updates? I think we've already covered that. Okay, so now we are on to the revised, working drafts of the articles, bylaws, plan of operation, frequently asked questions.
So it is our sense that the board would be helped because we have some early revisions that have already been rolled in to give a cleaner set, to better use of people's time. I think the sense is that the board would be helped if they had some time to digest that and we schedule another meeting. I think there may, Laura, we noted that the plan of operation was not posted, and that's another reason why I'm sort of uncomfortable, because we intended to publish everything before this meeting. So that will be posted in its correct version, correct working version, and then if we can find a time to follow up, whatever the board's pleasure is, we're glad to do that. And I apologize that we're in that bind, but we are, and thankfully we have cleaner versions. I would comment with respect to the redlining, we ended up having to do that manually, so we can't guarantee it's 100% accurate. When we move forward from what we're doing on the current working version, the redlining will be automatic and easy. So we will be able to track changes going forward. We had to reconstruct the changes back from the legacy documents that are on the website. So I think they'll help you find the sections where the changes are, but there may be a word or two along the way that isn't precisely redlined, and we apologize for that, but we did try to prove that over and over again, and it's pretty clean, I think. And Scott, looking over the weekend, for example, said he could find things, so I think it's workable for that purpose, and then we'll be working with the black documents going forward.
Okay, I know personally I did not have time to fully review the documents. I did not look at email on the weekend, and I apologize for that.
Well, you shouldn't have had to look on the weekend.
And I did not get to review the majority of the documents. I think I only got halfway through the second document before my schedule took over. But I personally would appreciate more time to review these, and I would love to reconvene maybe in a couple of weeks, maybe 3 weeks, 4 weeks, whatever we have, to discuss those further as a group while they're still fresh in our mind. Not to say that we're ready to finalize them, because I think that earlier we talked about perhaps it would be more prudent to wait to see the outcome of Medicaid expansion legislation, to make sure that we don't need to make further revisions. But I personally would prefer to discuss them while they're still fresh in my mind.
With the red, I understand, there's a red line from original to like the first version draft, and then there's a red line from that draft to a new draft, and then there's a clean version. And I guess what I appreciate is if there were
A cumulative red line?
Yeah, me too.
Against the website.
Yeah.
So why don't we redistribute? I think that's the better way to go, and we'll redistribute a clean working version and a red line versus the website. Is
That would be my preference. I agree with David on that one.
It's a miracle. This is twice in 1 year where we've had agreement with David on it.
Yeah, because I tend
6 more weeks of winter.
Touche.
Yeah, I find it easier to
Okay.
review in red line. Which is what you get used to, but. All right, so you're gonna
Do you
send
want to
over-
have us poll for approximately how far out, Sue?
Yeah, I think that would.
About, but what would you like us to show it as a target?
I don't
2
know.
months from now, or 1 month from now, or?
I'm trying to think, we're at the beginning of March. Yeah, maybe beginning of May. I don't know,
Beginning
how
of
does that
early
work
May?
in people's schedules? I mean, we should definitely do it before summer kicks in and people start getting busy with vacation schedules.
I'll also mention that the FAQs address a lot of issues that are going to come up at the May due date, so I think it would be helpful if we could have two of those and post them before
Yeah,
the
let's,
15th.
do you want to oh, I see what you're saying.
Yeah.
So, and I have not had a chance to review the FAQs either.
And we don't have to do that today, but I just wanted to make sure if we do it in early May, I want to make sure we have enough time here.
So that might take us back to late April, you say, if that's acceptable to
Or
the board.
maybe even mid-April.
Can we just do the FAQs? Do we have to do a meeting to do the FAQs? Can we just all review the
Send
FAQs
comments?
and do it and then vote electronically? Is that permitted? accompany all of,
FAQs are legal
the FAQs aren't
Are they a
long.
legal document that we have to vote on?
Well, one way we could do it, let me tell you what Vermont did for exactly, not for this reason, but because their legislature's in session and the bill is pending, and they don't know how the bill's gonna come out. They authorize a service, from mainly us, to publish advisory FAQs that say, these are subject to board review and will be subject to further revision. So we could take comments that way, Sue, and that would be really helpful, because
Yeah.
that answers, it's designed to answer the in-the-street servicing questions. So if that would be acceptable, we'll continue to take in, as we've been taking comments from board members as they came up, and then actually keep refreshing them. Lori Beth will be the captain of the FAQs, and then do the best we can until the board actually finally acts on them, but post them as advisory FAQs right away.
Yeah, and I sort of see the FAQs as changing. So,
Yes,
you know,
they
as
will.
you're seeing the same question come in 4 times, rather than, you know,
Exactly right.
let's just be proactive and dump it on the FAQs instead of waiting for the board to approve it. Because they're more,
They're more administrative.
Exactly.
They are. Yeah,
So,
they're
right,
not.
then if I send it out, like we did other documents, just blind CC to everybody and ask for comments back to me.
Yeah, that's not a discussion or deliberation. You're making sure that you're getting all the information you can get, performing your administrative duties, giving information out.
It's helpful. So we would view this as a servicing obligation, and we will structure FAQs as we understand the board's policy, and then we'll stand corrected if anybody has any comments on it. That works? That's usually helpful, by the way. Thank you, Sue.
so Lori Beth, if you want to circulate the FAQs and then give people what you feel is a reasonable amount of time to review them and get back to you, and there's always that fine line of too much time. I know I tend to lose them in my email and I never look at them again, but I think everybody probably needs a little bit of time to account for reading.
Is having them out this week and then ask for a week?
Yeah,
Is that
that
fair-minded?
seems
So by the end of
reasonable.
this week, Lori Beth, can you send them out? They're actually very clean right now, but I think one more pass might help you.
And you'll just
then-
BCC each of us, and then what I would ask is that each board member just send their comments to Lori Beth instead of the entire meeting.
And those will be posted to the web, and then they'll be posted as advisory FAQs, subject to board review and revision whenever we meet, which will be, now what do you think? Are we back to April, late April as the target?
I think May, because you're gonna run into, school vacation.
Yeah, I would prefer not school vacation, actually.
If the reason to push April was the FAQs and we solved the issue, then there is no push right now.
Right, May
So
would
That's
go
exactly
ahead.
right. That's exactly right, Dr.
We wanna do it the first week of May, and we wanna do it on Tuesday, so.
You know, regrettably, I am out of state that day. Actually, I'm out of state the first 2 Tuesdays of May. So any other day that week would work for me, or any other Tuesday in the month, other than the first 2. So the 13th, the 20th, 27th, all would be open.
You see the 13th is on,
It's open for me.
I understood that you were not here the first.
The first 2, which are, oh, I'm sorry. Thank you. I'm not here the first 1. The last Tuesday of April and the first Tuesday of May, I am committed out of state. So the 13th, 20th, and 27th, if we want to stick with Tuesdays.
13. It does.
It
We're
worked for me.
getting, we're getting nods on, do you know David?
Yep, that's good.
So all the board members here are okay, so can we just book it that day?
Yeah.
We have the majority, we have a quorum,
8:30?
8:30 would be fine.
13 May?
Yes, here. Thank you, that's wonderful.
Something weird, something.
But Terry, can you send out an invite? That way we make sure we're getting people who are not here today.
Then you've given us direction on everything in item 5.
Yep. So, and we did not hear any additional matters from board members earlier. Is there anything that anyone would like to bring up at this point?
There's the conference, we went to, give a last push for the conference?
Oh, yes.
The conference is March 26th. So that's a couple of Wednesdays from now. It'll start at about 8 o'clock in the morning. And it's probably more packed with information than we've ever had before. We're going to be talking a lot about adult immunizations. Because as you know, or may not know, the standards for adult practice around immunizations has just been released. And we are beginning to push towards asking our medical providers, pharmacies, wherever we can get adults vaccinated, to begin to take a stronger look at whether or not a person needs to be vaccinated as an adult. So we're doing a lot around adult vaccination. We're doing a lot around quality improvement. Our friend Dr. Lamb is going to be speaking on how one can talk with parents, patients about vaccines. We have somebody who is taking up the banner about quality improvement in terms of performance around HPV vaccines. Again, we've had this very small uptake in HPV vaccines throughout the country, but the impact on the disease has been fabulous. The disease has reduced. So there's a lot going on this time. Dr. Montero is going to be talking about the integration of public health and clinical care. So many reasons to come. Again, it's March 26th. We'll be down at the Radisson in Manchester. You may still register by going on nhipconference.com.
Anything else? I think we are at the portion of our meeting where we solicit comment from members of our public. And I apologize for my back.
Well, let's put it right.
Okay.
Thank you for the opportunity. I did, in the discussion here about your next meeting, I was a little bit confused because there were in the documents here mention of a meeting for April 15th. And am I to understand that the April 13th, the April 15th meeting has now been changed to May 13th? Is that correct? I didn't see the April 15th meeting on your calendar, but I do see it mentioned in your documents.
I'm sorry, I don't know what you're referring to, Laura, and I don't think we have it on our meeting calendar.
Okay.
I do not have it in my calendar.
It was this document right here, Fred, we had talked about.
Oh, that was offering that as a possibility
Okay.
to deal with, but the board, that was in the suggested vote, we had offered a time frame for following up to this meeting for approval. I think the board just superseded that by its own time frame for following up in May.
Okay, and then you added the May meeting.
Right, so
Right,
that
so
time
that
frame
is
and
not
that
gonna
that proposed vote was not adopted,
Okay.
so,
Okay,
yes.
that was just a clarification I was looking for. I was also wondering if there is an accounting anywheres of the vaccine waste. I know that in your spreadsheets of purchases, there's a projected percentage of what you presume that vaccine waste would be. And I'm just wondering if the state tracks that, or if the Vaccine Association tracks that, if doctors track that, where that's being tracked, because we know it exists, and what are the real numbers, rather than a projected percentage.
We have the real numbers.
Yeah, they're less, I know they're less than 2%. Again, they're very small, and we actually have tracked that very extensively in this last year because we're doing a report on that. And certainly we can
We
release
can
that.
bring
I
it
think
up here.
we're doing that for a calendar year, so.
So a request to the Department of Health and Human Services would be the appropriate place to get that information?
Absolutely.
Okay.
So maybe
But
what we ought to
can bring
do.
it to the board, right?
Yeah,
I'd
we
be happy to
generally
bring
weren't
it
going
to
to
the
do
board.
Q&A here, so we may want to think about your filing your requests, and I
Sure.
think I've been instructed to follow up after the meeting, so I can take a list of whatever your requests are.
Sure, I can do that. Just
As
one
usually, it's a
word
little
right.
hard because we got two people aren't even right next to each other trying to make a decision on the fly.
Yeah,
We
I was
decided we should
also,
meet on
additional information gathering is the listing of the payees for the vaccine assessment as well, where that information might be available.
Just so I can understand your request, which I will try to respond to, the payees?
Right, those that pay this vaccine
You
assessment.
mean the payers?
Right,
Okay, those who make payments?
right.
Okay.
That's what I meant. And also with regard to the state vaccine registry, I was wondering what other states have funded their vaccine registry through health insurance premiums, the way that this one is being done. I'm also wondering if there's been yet any legal challenges to this funding mechanism.
This
That-
funding mechanism meeting, so I can understand what your question is.
For the
NHVAC?
for the vaccine registry, yeah. Where it's not authorized in the statute to be funded through this association. So I was wondering if there were legal challenges yet to that. And also I was wondering, with that vaccine registry, will they also be tracking, as we well know, the injuries and deaths that follow subsequent to vaccination? Or does not being picked up anywhere? So that if we're going to use this, will it be a useful tool? So those would be my questions.
Okay, so I think I heard four follow-up questions. You got
That
an
is,
answer to some
that
of
is
them.
correct, and I can put those in an email to you. if
That'd
that
be
would
usually helpful, and I
Okay.
will turn them around per board instruction.
Yeah,
Some of them I may have to say I don't know, but I'll let you know if I don't know.
okay, I appreciate it, and I
Sure.
appreciate the opportunity to share my
Thank you.
questions and concerns, thank you.
Are there any others?
Nope, that's it, thank you.
So I have four, but Laura Condon has said she would confirm by email,
I
and
will.
then I will follow up per the board's instruction for me to
Okay.
do that.
Are there any other issues to be brought before the board today? Okay, hearing none, would somebody like to make the motion that we adjourn?
I make a motion.
Would somebody like to second that? All in favor, aye? Aye. All opposed? Hearing none is unanimous, we are adjourned.
Good job.
And before
We-
10:30.
Quite impressive, actually. And I mean, I think it's given some
I was
clarity.
wondering if you were not going to.
There we go.
You asked me yesterday, there was someone said, I think someone doesn't take that as she wanted to hear.
Not yet. No. Okay. Thank you.
Yeah.
Come and watch.
Right.